open to the floor if anyone wants to just throw in. Does anyone else here want to join in on the topic?
Thank you, Jack, for your question.
All right, absolutely, go for it.
Thank you, Jack, for your question. As a researcher, what we found was we interacted with a lot of young researchers, and we found that they've been affected by unpaid labor more than ever, because as much as they're unpaid, they're also going through COVID-19 pandemic, and they've lost their jobs if they had one. And then they're doing voluntary work, which is not paid again. And when they're at their homes, secluded from the society, I think they're going through a lot of mental trauma as well. So the pandemic has hit them the hardest. Usually in the crisis situation, we have always felt intensified pre-existing barriers which already existed before. And it always affects vulnerable groups, for example, young women and the young volunteers who actually are, again, prior to the pandemic, they go through generational inequality at policy, program, and organizational level. So I would also like to say, as you asked, like, what did we go through when we were researching in COVID-19 pandemic? When we were researching, we had to circulate surveys. And I think we lost out on young participants who were actually deeply rooted in grassroots level because they do not have access to digital platforms. So we had been circulating our researches in social media and all of the platforms that we had access to. But I think we lost out on the grassroots level because we were not physically able to go to the grassroots areas of, for me, Nepal, and in my team, there were other people from South Asia who were going through the same thing as well. And we also felt that, especially young women volunteers, because there is existence of traditional gender roles, especially in South Asia, where this is a new concept, which is double labor. You allow, allow is the word that I'm using right now because of the society and culture, and then the situation of developing country is such that it's layered by religion and sub-layered by culture. So women are responsible for the household work as much as they're responsible for the work outside of home. So even though they work outside and they're earning, they're also responsible for the traditionally existing gender roles. And when we researched on the young women volunteers, what we found was they were having a lot of burden because they were first unpaid as much as the other young volunteers. But they were also going through traditional gender roles at home. And if they had a job, even during the pandemic, they were doing that as well. So I think that put a lot of pressure on young women volunteers and maybe volunteers who had disabilities, volunteers who already had mental health issues, and that got intensified. So I think the crisis situation makes us realize that we need to be prepared beforehand and not just respond in crisis, but before crisis, we need to realize and map out the areas which actually have barriers already so that we could solve that and not let it get intensified. So I think that was the experience that I've had during my research.
That's